Coming up on the Doctor's Hospital podcast.
Studies have shown that elevated cholesterol, particularly what we call the bad cholesterol or LDL, has been shown to put persons at risk of developing dementia, as well as diabetes or having uncontrolled diabetes or very high glucose levels.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome to the Doctor's Hospital podcast. I'm your host, Alexis Burrows, Marketing Director at Doctor's Hospital. September contains a special focus day. September 21st is recognized internationally as World Alzheimer's Day. And we wanted to have an opportunity to talk through what Alzheimer's is, what it looks like, how it differs from other disorders, and kind of give people some guidance on how to manage if you think that you have it, or if you have a family member that you're offering care for, and kind of what that entire process looks like. So we are joined today by one of a specialty physician who is a specialist both in family medicine as well as gerontology, Dr. Indira Grimes. Welcome to the show.
Thank you. Good morning.
So we are happy to have you on, like I said, to kind of talk through and get some insight into Alzheimer's. I feel like, it's something that we don't often talk enough about in the space in our community. And obviously it's something that I think, if people sat down and were honest, there's at least a family member here or there, or a loved one or a friend that they know who either has had it or has a family member who's had it, who's gone through that process. Or is taking care of someone who has it. So, I think it's a good opportunity as this day of recognition is coming up to kind of talk through that with you. So I like to kind of start at the ground floor. When people stop and think, you have things like dementia, things like Alzheimer's, reduced mental status, all these different things. How does Alzheimer's differ from other forms of dementia? And what is it exactly?
Thank you, Alexis, and thank you again for having me. That's a really great question. Alzheimer's is a progressive neurocognitive disorder, and it actually is the most common type of dementia. It accounts for 60 to 80% of the cases of dementia diagnosed.
Oh, wow.
Now, this type of disease is usually one that occurs in older adults, meaning that they're usually over the age of 60 years. 65 years, and it usually is manifested by memory loss that is gradual, progressive. There may be also difficulties with language and communication, disorientation, changes in mood and behavior, as well as impairment in thinking and judgment. As the disease progresses, individuals tend to need more and more care with their daily function with simple tasks. It differs from the other types of dementia in the way it presents, as well as in findings that we may pick up on certain tests that we would do to determine the type of dementia that may be occurring. The other types are vascular dementia. Okay. That's the second most common type. Vascular dementia tends to occur after there is interruption of blood flow in some way to the brain, usually a stroke. So hence the title vascular.
Right.
And so you see similar changes that you would see in Alzheimer's, but it tends to occur after this insult to the brain. Then the other types are Lewy body dementia. Lewy body dementia tends to present with fluctuating symptoms. So the symptoms come and go. They tend to have changes in their alertness, their attention span, and they have visual hallucinations that occur early and are very vivid and real to the client, to the patient. And this will, of course, affect their behavior. They may also have motor or movement symptoms similar to what people see in Parkinson's, like the tremors, slowness of movement, and so on. The memory loss in Lewy body dementia tends to occur later, whereas in Alzheimer's, that's one of the first things people notice.
Okay.
Frontotemporal dementia is another type. This type we may see early on, and meaning that in younger ages
Okay.
than 60 and 65 years old, maybe even as early as persons in their 40s or 50s. And this tends to lead with changes in personality and behavior, and before the memory is affected.
Mm-hmm.
So they tend to behave very differently than one knows them to be.
Mm-hmm.
And this affects their functioning. Also, findings in their brain imaging will indicate changes in the brain structure in the front of the brain, so frontotemporal. And then you have other types of dementia, mixed type of dementia, which may be different types all at once
Mm-hmm.
occurring. Some of the types may be a reversible type, meaning that it's due to some chemical imbalance that once treated, the person, the changes may reverse back
Right.
to normal.
There's a possibility of reverting to normal.
That's
Right.
right. Mm-hmm.
So it's interesting, because obviously the vascular one sounds like one that isn't quite as age dependent. So like,
That's
you have
right.
a stroke at 35 by some stroke of bad luck. Then you have the potential of that being an option. But it seems like other than frontotemporal, a lot of the other ones, it's based primarily on age.
Right.
So it's an interesting thing because you hear people talk a lot nowadays about their capacity and all these things, and seeing as you go through the list, and this is why it gets interesting to talk through symptoms with people. It's like, well, I don't always remember where I put my keys. I don't always remember this, that, and next, and this is kind of the train of thought that people go down. But what are some of the early signs and symptoms of Alzheimer's that I guess family members should look out for? Because I guess it might be difficult for the patient themselves to be able to look out for it if they're starting to have things like memory loss and things like that. But what are some signs that other members of the family, loved ones, friends can look out for?
Yeah. So memory loss usually is the one persons pick up on first, or it seems more prominent to family members. Usually a short-term memory loss. They tend to also have difficulties with language and communication.
Mm-hmm.
They tend to become repetitive in retelling things, asking questions about something that might have just been said, discussed, or done.
Mm-hmm.
Difficulties with finding words to express themselves. And so they're not able to complete a sentence or a thought,
Right.
because they have lost the ability to pick up the words that they're trying to say.
Mm-hmm.
And then disorientation, the forgetting things tends to have them kind of not being able to pick up where they are, what they're doing, carrying out a simple task.
Mm-hmm.
These tend to be the early signs
Okay.
that are prominent.
The memory loss, is that both like short term and long term?
Well, the short term happens first,
Mm-hmm.
and then eventually long term memory is affected as well.
So I remember in the last few years of my grandmother's life, we would go to visit her, and you would walk in, and there was a particular phrase she used to use to reference like me when I was like, oh, look at my handsome grandson, right? And then it's like 3 minutes would pass, and then she would say the exact same thing, and it was always the exact same wording. And then a few months later, a year later, it was, oh, who are you again? And so you would kind of have that. So I guess it does kind of speak to where it's you see the difference in that, because I think that the repetitive speech is a part of it, right? Like
Yes.
the end of the exact same like phraseology.
Yes.
Yeah. Okay.
Yeah.
Yeah. So I think, like I said, I think the thing about it is we have this difficulty sometimes as a culture of putting names on things and accepting what we're seeing and getting help. And I think we'll come back to talking about the importance of that a little bit later. But thinking through the symptoms, thinking through the early signs and how it affects, what are some of the risk factors associated with Alzheimer's, and are there ways to reduce the risk?
Well, aging is one, and that's not anything we can do.
Stop that one.
Right. So aging, it is one of those things that can put one at risk.
Mm-hmm.
Family history, genetics, because there is a gene that's associated with Alzheimer's disease. It's called ApoE4. It's a copy on a gene that can occur, and persons can have a family history. So where you usually tend to see that where you have siblings developing dementia, or close relatives, a parent and a child.
Right.
And when tested, they're likely to have the gene mutation going on. And then we have, so those are your non-modifiable.
Right.
You can't
There's
do
nothing you can do
anything
about
about that. So the modifiable ones tend to be cardiovascular health related.
Okay.
So heart disease, high cholesterol, hypertension, diabetes, being overweight, and smoking are some of the top modifiable lifestyle and health issues that can put one at risk of these problems.
Okay.
Mm-hmm.
So, if someone's starting to see the early signs and symptoms, but they're not quite sure yet, what is the process for diagnosing Alzheimer's? And like, what are some of the tests that people may go through in the process of trying to determine if they indeed do have it?
Well, if anyone notices themselves or a loved one experiencing symptoms that may be associated with dementia, they should see their physician right away and have a checkup, have an evaluation done, express their concerns so that they can have the proper tests run. Usually, we recommend a complete physical. And so this starts with, of course, taking a history and finding out what exactly are the concerns, examining the patient, and then doing some lab tests, because there are reversible medical causes of dementia-like symptoms. For instance, hormone imbalance like thyroid disease, anemia, that is a low blood count, or certain vitamin deficiencies. There are communicable diseases such as syphilis and HIV that can also bring on a type of dementia in the course of the disease. And some people may have these illnesses and not realize that they are positive for it. And we have discovered persons for the first time positive with these communicable issues, much to their surprise. And so when treated, it tends to help symptoms,
Right.
and in some cases reverse the problem. Further, of course, as we mentioned, cardiovascular health is a risk factor. So looking at their heart tests, doing an EKG, doing an echo, checking out their heart health. And of course, screening for diabetes and high cholesterol. And then brain imaging is a big test, a big evaluation factor. So brain imaging can be a CT scan. It will not tell us as much as we'd like, but it is an affordable type of brain imaging. The better ones are an MRI of the brain that looks at the structure of the brain, as well as there are certain MRIs that can tell us the metabolic function in the brain. And an even better scan is a positron emission tomography, which is a PET scan. These PET scans look at glucose uptake and the metabolism going on in the brain. And if it's happening in certain areas in a certain way, this can point us toward the type of dementia that could be occurring. Also, there are PET scans that look for the proteins that are associated with causing Alzheimer's disease. So you have these amyloid deposits around the neurons. The neurons are the specific cells that function in the brain. And then you have these other proteins called tau, TAU proteins that actually develop inside the neuron itself. Both of them change the configuration of the brain structure and cause dysfunction,
Right.
and dementia.
Okay. There's a there's a lot there. Because I guess like you're saying, there's certain elements of it where it could be tied to other parts of your overall health picture. And so going through that process, you want to make sure, I guess it's almost like a process of elimination to see what all is involved. And then trying to determine if it's this particular version of dementia, if it's Alzheimer's, what exactly are you dealing with?
Right.
You have an interesting question, kind of off our list a little bit. How do you determine if it's worth going through scanning, right? So let's say, you're looking, a mother, a grandmother, an elderly member of your family who's, 80, 82, 85, somewhere in that range, and you're seeing some of these signs. And as a family, you're trying to determine, hey, where is the value in pursuing versus do we just let it ride? How do you kind of guide a patient or a patient's family in navigating that decision? Because it's one thing if, you're 60, 65 and you're like, well, there's still some, I hate to put it that way, but like there's this idea that there's a lot of life here to be lived and it's worth going through down this rabbit hole, so to speak. But what would you say, or how do you kind of guide patients and patient families in those sort of instances?
Well, that's an excellent question, and very relevant. So dementia has stages.
Mm-hmm.
Alzheimer's disease can go through from a mild to moderate to severe stage.
Okay.
So, and even before the mild stage, there's something called pre-dementia or mild cognitive impairment.
Mm-hmm.
Mild cognitive impairment is simply where there are some changes in being able to perform simple tasks and changes in memory, but one is still completely functional and independent.
Mm-hmm.
So they're not diagnosed as having dementia, but that can be a precursor to developing dementia of any type. And then you have the mild stages where persons are seeing some more deterioration. They're not being able to do certain executive functions like balance a checkbook, manage medications, drive, but they can prepare simple meals, make their bed, go to the bathroom on their own. And then moderate disease, you start to see the basic functions like go into the bathroom, being able to feed oneself and mobilize and do stuff start to deteriorate. And then severe, where they require all levels of help for all basic functions. So to your question, if we have an older person who has signs and symptoms of dementia, their scores indicate a pretty severe or advanced stage, I would say, and we've ruled out reversible causes through labs, then I would say putting them through imaging may be null and void because at an advanced stage, experts recommend to avoid putting them through the side effects of medications and treatment because there's no real benefit to it. However, if they're going through a mild or moderate stage, imaging may still be necessary because there may be a way to determine the type of dementia they're having and putting them on some management that may help to slow the progression of the disease, maybe to their benefit to improve their quality of life as best as possible.
Yeah.
Now, there are times, though, when persons are going through this change and families realize that they need to appoint power of attorneys, health proxies, do legal guardianship.
Right.
And if usually a medical report is required in these instances to be presented to the court for these documents to happen. In any case, then the doctor will have to do due diligence and put them through the proper evaluations, including brain imaging, so that they're accurately documenting the findings for the legal entities.
Right.
So those would be the instances for legal reasons, to determine the disease in the mild or moderate stage to determine management. But if they're severe, advanced, and quite elderly, and other illnesses are going on, that might not be necessary.
Understood. All right. And I think a part of that question leads into our last question before the break. What treatment options are available for Alzheimer's and how effective are they? Because I think that's a part of it, right? It's like if you're going to chase this down, then the next question becomes, okay, so if we find something and we find that it is this, then what are our options for treating it, managing it, to try and slow the progression, or if it's a reversible form, to try and reverse it. So what exists in that space?
Right. So first of all, we recommend decreasing risk factors as much as possible. Studies have shown that, in fact, recently published earlier this month, have shown that elevated cholesterol, particularly what we call the bad cholesterol or LDL, lipoprotein, low density lipoprotein, that type of cholesterol has been shown to put persons at risk of developing dementia within 8 to 10 years of it being identified, as well as diabetes or having uncontrolled diabetes or very high glucose levels in the blood. These things have definitely been shown to put persons at risk. So controlling those things, normalizing those values are a big part of reducing risk and reducing disease progression.
Mm-hmm.
Now, if they're usually in mild cognitive impairment stage, that is pre-dementia, studies have shown that putting them on medications can help slow the progression, as well as brain health supplements can be helpful. There are things like Prevagen out there, Neuriva. Those have helped persons to improve on focus and
Mm-hmm.
concentration. Mild cognitive impairment, mild dementia. There are medications called acetylcholinesterase inhibitors like Aricept or donepezil
Mm-hmm.
and galantamine. So these medications are usually recommended. Now, they do have their side effects like stomach upset and diarrhea, even nightmares.
Oh boy.
And so, yeah. So we do advise patients on these and look at how the benefits outweigh the side effects. And then there are additional medications like Namenda to add in the moderate stage.
Mm-hmm.
But like I mentioned earlier, in the severe stage, we may pull back on medications because they have no real benefit.
Right. I'm smiling a little bit because I'm always impressed when physicians get to talking about things where it's like I clearly, this is why I'm on this side of the microphone and not that side, because just remembering all of the complicated names of drugs and things like that, it's just so much. But it's always it's impressive to hear, and then just kind of the level of knowledge and understanding. And I guess I actually didn't realize that there were so many potential options for assisting with treatment with it. I think again it goes to the cultural question and the cultural point of, we just tend to pretend like things don't exist, especially in that space. And then therefore you never even consider like, hey, well, if we found out and there was something we could do and slow the progression, then it's beneficial to do that.
Right.
All right. So we're having a very good conversation with Dr. Indira Grimes, talking about World Alzheimer's Day and everything related to Alzheimer's. Very, very good conversation thus far. We're going to take a quick break and we will be right back on the Doctor's Hospital podcast.
Experience the immediate care you deserve at Doctor's Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctor's Hospital West on Blake Road for immediate, trusted, and best care.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation on Alzheimer's with Dr. Indira Grimes. So we're going to pick back up, and I think there's one or two things that you probably want to add on to our earlier conversation, but I think our next question kind of leads into that. So how can caregivers and family members best support a loved one with Alzheimer's? We talk about some of the cultural issues that exist. We talk about some of the need. There's a little bit of this was off air, but the need for protections in this sort of space. But how do you advise caregivers and family members when they're dealing with a family member that has Alzheimer's or some other form of dementia where it's impacting them greatly?
Right. So, as I wanted to add that even though there are treatments for Alzheimer's disease and other types of dementia that help to slow the progression,
Mm-hmm.
unfortunately, there is no cure on the market yet for any type of dementia. So the treatments only help to slow down the progression and help to improve and maintain quality of life at its best at every stage.
Mm-hmm.
So, because the disease is progressive, caregivers have to understand that the signs and symptoms will get worse eventually over time. It could be anywhere from 5 to 10 years of expected progression from mild to the severe level of the disease. And they must understand that at every stage, the client will need more and more involvement and assistance of a carer, of a care partner. This can become very burdensome on any one caregiver and quite stressful because, as I mentioned, they not only have changes in memory, but their personality changes, the way they communicate changes. And so the person that the carer once knew, whether it's a relative, a friend, um, changes. I mean, they're not. They become somebody totally new and different. They may start using expletive language, foul language when they were a God-fearing person. They may start to do very strange things around the house and become very difficult to communicate with, difficult to understand instructions and so on. So one should educate themselves first and foremost about the disease, try to read up on things, get as much care, support information. If there are support groups available, they should join in one to talk with other carers and their experiences, ways in which they can cope and deal with certain common situations. Remember that the patient still has moments where they remember themselves and who they are. So, moms and dads tend to always remember that they are the mom or dad, and they always want to be respected as such, not treated as a child. And so, you have to always involve the patient as much as you can in the decision making. Don't decide for them that they must stop driving or they must stop cooking, but talk to them in such a way that you're concerned about their safety, you're concerned about what could happen should they forget something. And so there's a discussion about stopping or curbing some of the functions they're doing for safety reasons. And that conversation could be supported by a healthcare professional. So the doctor can help assist with it, a nurse, and so on, so that there's a third party there to support the plans. Involve them in therapies that can help strengthen their memory. So reminiscence therapy is a type of therapy where you go through pictures and things and go over things of the past to strengthen things. Go over familiar tasks. Keep a routine and keep the routine very simple and consistent. So you have a schedule of time to do this, have breakfast, have a bath, go to this appointment, watch TV, do some reading, go out for a walk, and so on. Healthy lifestyles are important not only for the patient, but for the carer. So eating healthy, getting physical activity in. The carer must try to involve time to take breaks and share the burden. So if you have siblings who can help, other family members, if you can afford a carer who can come in a day or two to help, or do night sitting where they give you a night's rest. Somebody else is with them, because in dementia, there are a lot of sleep problems, sleep disturbances. The person does mix up day and night. And so they might be up all night, but sleep all day. And this is very difficult for a carer who has to get up to go to work the next day or do other tasks. So you might have to get somebody in to pinch to sit with them at night so you can get some rest. And so open up that avenue in getting help with sharing the burden and sharing tasks. Take breaks. It's okay to take a weekend off, to take a night off, to take a day off, go away, travel, go to the spa. Don't feel bad about that. If you don't take care of yourself, you can't take care of anyone else.
Right. Yeah, you're not going to be in prime condition to be a caregiver for someone else.
And sometimes people offer to help. There might be volunteer groups. There might be daycare centers. You can do a drop off to a nursing home that does respite care, where you can leave them for the weekend, for a week, and go ahead and have the family vacation and come back.
Right.
And check in with them via phone, via Zoom, via FaceTime call, and so on, to ensure that everything's going okay. Keep your communication very simple and straightforward. Try not to get into arguments, because you tend to be the one to get stressed out after the argument. And try not to press agendas that are your own. For instance, if they don't want to get up to bathe at 9 a.m., then try to pivot and maybe move it a little later. You go and bathe. You go and have your breakfast and come back to the loved one about doing that same task. And they may cooperate, but if you keep pushing and they don't cooperate, it could become more stressful for both of you. And then planning. Because this is progressive, one has to be ready for the next stage. Sometimes, we're not good in this small society of putting things in place ahead of time, writing wills, deciding who's going to be our decision maker. Should we not be able to make a decision for ourselves health wise? So that's a health proxy, or establishing a power of attorney. Legal guardianship matters may have to be discussed, and that is something that you can prepare with your legal representative and also discuss with the healthcare provider on how and when this should come into play. These things help a lot because when things become difficult, if there's somebody who feels able to help make decisions on behalf of the patient or loved one, then these make things a lot simpler in the long run.
Yeah. It's that caregiver space can be very difficult to navigate. We had my mom went through a cancer journey, and the last few months of that, we had someone who was assisting us with providing care. But when it came down to those last few days, me and my siblings, my wife, a lot of us were in and out, and it can be very difficult to navigate because at the time, there were complications. It had spread to the brain. And so my mom wasn't very communicative. And you have all of these sort of things that you go through, right? But it is a lot. And I agree full on with the recommendation, especially if the family member is the primary caregiver. Then it's imperative to find time and space to recharge, because when you're talking about, so like in our instance, like I said, towards the end, my mom wasn't really able to communicate at all. But I know in the Alzheimer's space, which you have, sometimes there's a lot of disjointed communication and communication that may not make sense. And if you're, like you said, going down through a topic or an agenda that's too complex, then you get into all sorts of difficult things. And is that need to kind of step back and have time to yourself? Because
Yes,
again, if you're not taking care of yourself, then you're not going to be in a position to take care of them. And then you want to make sure that you're in the right mental space to do it, so that you're
that's
not
right.
susceptible to falling into something that might be tending towards abuse or mistreatment, just because you're frustrated, and then that
Absolutely.
comes out in ways that are not helpful.
No.
So yeah, it isn't. It's that space of being a caregiver is a very, very difficult road to walk. Um, and we talked about this off air. Yeah, I think families are smaller. The social support network is a lot different than it used to be, and so that makes, even when you're dealing with this, it makes it that more difficult to navigate. People everywhere are talking about financial struggles. So you don't look at it and say, well, I'm in a position to bring someone in to assist, and so you have all of those things that you have to navigate. But at the center of it all is, you want to make sure that your family member is getting the best possible care. But then if you are directly involved in providing that care physically, then you're also taking care of yourself.
Yes, absolutely. Self care is of the utmost importance for caregivers, and it's okay to think about caring for yourself. Planning also helps,
Mm-hmm.
because planning and scheduling where possible also helps, so that you're able to do what is within your capacity as time goes on. And then when the care becomes overwhelming, and that can happen,
Mm-hmm.
especially when you don't have enough support outside of yourself to help, then look to other entities to help, like nursing homes,
Mm-hmm.
geriatric hospital, daycare centers, respite care centers. That's okay, because sometimes the next step is necessary,
Mm-hmm.
and because it's beyond what you can do.
Right.
And so you should seek that, and also have an idea of when you want to bring that level of care on, because it may not happen overnight. For
Mm-hmm.
instance, there's paperwork, there's finances to sort out to get them into a facility. And so that may take some planning and some time
Mm-hmm.
to accomplish.
Yeah.
And so that also needs to be thought about ahead of time.
Yeah. I think one of the most important things there too is you know your limits, right? Physically, financially, emotionally, you have to know your limits as you navigate that. Um, I keep going back to this cultural conversation. We're not the best at this, but I imagine that there are a ton of different misconceptions that you come across as you interact with patients and patient families. But what are some of the most common misconceptions about Alzheimer's disease? And then how do you go about disputing those?
Well, the most common misconception is that Alzheimer's just happens because one's getting old.
Mm-hmm.
Now, as I mentioned earlier, aging is a risk factor for developing Alzheimer's disease and maybe other types of dementia as well. But it is not normal because one is getting old. So many people believe that doting and memory loss and some strange behavior is normal just because the person is getting older.
Mm-hmm.
And it's not until things get complicated, maybe they're really behaving strangely, difficult, not sleeping, etc., that they bring the problem forward to a healthcare provider.
Mm-hmm.
By then, things might be quite advanced and it's very difficult to help the situation. So when you notice early changes happening that are not in keeping with the normal functioning of a person, that should be brought to the doctor's attention very early, because interventions might be able to be put in place to help the person to live their best life, even while they're not so well.
Mm-hmm. You mentioned this a couple of times, and I think it's something that we've had conversations about a number of different health issues and ailments over the past year, on the podcast about lifestyle changes. And I always find it interesting because it seems to be something that has a at least some level of a benefit in almost every conversation that we've had. Now, Alzheimer's to me seems to be an interesting one. How much does lifestyle change, like things like diet and exercise, play in the progression of Alzheimer's? So let's say, you've already seen the signs, you're either, pre-Alzheimer's or in that first early stage. Is there a role or an impact of lifestyle change at that point?
Absolutely. Lifestyle changes make a big difference. So, healthy nutrition is very important.
Mm-hmm.
Lowering cholesterol, saturated fat in the diet, lowering sugar. Sugar contributes to inflammation. Inflammation is a big causal risk factor for many of the diseases that we live with: high blood pressure, diabetes, leading to stroke and kidney disease, liver disease, all of that. So if any way you could lower inflammation through lowering sugar intake, lowering saturated fat intake, makes a big difference. So choosing healthy foods, fresh fruits and vegetables, more high fiber, lean meats. What we call the Mediterranean diet is good and nice and balanced because this encompasses a lot of what I said already. Not fried foods, avoid fast foods.
As you tell Bahamians to not be Bahamians.
Right. And then being physically active on a regular basis, deliberately physically active, not just walking around at work. A lot of people will tell me, well, I walk a lot at work and I climb a lot of stairs at work. Well, that's great. That gets in some steps, but kind of adding like 30 to 45 minutes a day of some moderately intense physical activity, whether it's jogging, swimming, bike riding, doing aerobic exercise class, something that gets the heart rate up, gets you sweating. You're not able to have a conversation during that exercise period. You're burning calories so that you're keeping your heart health optimized, as well as your brain circulation optimized through this exercise. This helps to prevent diseases like dementia.
I've even seen and heard of people doing like seated exercises for those who may have like stiffness where they can't necessarily go and take a jog, especially as you're talking about Alzheimer's and an older population in that space in particular. So I imagine even that would be helpful because you're talking about just getting the blood flowing. But there are things like there's a ton of YouTube videos out there about seated exercises that can help. Either if you're the person listening and you're in that space, or if you're a caregiver, don't think that there's not an opportunity to do physical exercise just because the person is not maybe in a position to get up and do a walk or a jog or a swim.
That's right. Yeah. So low impact exercises, seated exercises, Pilates, yoga, Tai Chi are also helpful. So, and like you said, you could download it off of YouTube.
Mm-hmm.
Exercise is free,
Mm-hmm.
mostly, and also choosing to eat healthy is also something you can do without paying for it. Gardening is a great form of exercise too, and if you
Mm-hmm.
garden and grow your own vegetables,
It's a 2 for
then
1
you get to
special.
eat that.
Mm-hmm.
And so it's a lot of things we can do to help our to make healthier choices and
Mm-hmm.
decrease our risk factors for these problems.
Right. Another, particularly repeated topic of conversation as we go through these is the importance of early intervention. So, is there such a thing as early intervention as it pertains to Alzheimer's? And if so, what does that look like? What steps should individuals take if they suspect that either they or a loved one is showing signs?
So see your doctor very
Mm-hmm.
quickly. You may be referred to a geriatric medicine or gerontology specialist if your healthcare provider thinks you need further or specialized intervention. Definitely, you would have early tests done, early diagnosis made. Some people may not even be developing signs of dementia and just need that reassurance and to get back on their healthy track
Mm-hmm.
to prevent anything from happening. It would help to identify risk factors, and your healthcare provider could help lower your risk factors through any advice and intervention offered early. And then, of course, if unfortunately one is diagnosed with dementia, then treatment could be offered as early as possible to slow down the progression of the disease and help persons develop a better quality of life and plan better for any stage of progression that may be in the future.
Mm-hmm. Yeah, I've heard people mention in the space of diseases like this, illnesses like this, that sometimes it's more about getting more quality out of the life that's left in you, the years that's left in your life, more so than necessarily extending the amount of years.
Right.
And it seems like it's a similar conversation in this space as well. So our last question, you mentioned there's not a cure at this stage, but what advancements in research treatment for Alzheimer's? I know you even mentioned off air a little in the legal space about protections for individuals who suffer in this space. What are some of the things that are advancing, whether it's legally, medically, treatment, diagnosis, that you're most excited about?
Right. So, medically, the research is ongoing almost daily.
Mm-hmm.
So, there are these monoclonal antibody medications called MABs that have been developed. You might have heard about them in the news, like aducanumab, ducanumab, lecanemab. They all end in mab.
Mm-hmm.
So these medications are offered in the mild to moderate, very early stages of disease. They're IV infusions. They're given in specialized centers available in the States. They're not available here in the Bahamas because you need a whole team around you while you're getting these medications.
Mm-hmm.
You may get the IV infusion once or twice a month and be tested quite regularly to see the effects of the medication. They do come with, they're very expensive, and they do come with possible heavy side effects like swelling of the brain. And so some of them have been developed and taken off the market because of their serious side effects. Now, they only help to a certain point, and they are not available for persons who have advanced disease. So those are the latest developments in treatment. There are developments also in scanning, using, I mentioned the PET CTs, where they're looking at uptake of glucose, changes in proteins in the brain, looking for those amyloid and tau proteins to determine the type of dementia and the severity of the dementia in parts of the brain. So they're developing those quite a bit. In terms of the legal parts of things, many countries are being asked to put forward an Alzheimer's plan. What's your plan? Governments are being asked to make sure their health and social entities are making this a prime priority in their health, in their plans for older persons. including not only just what legally protects older persons from abuse and persons with dementia, but also how is society changing around to accommodate persons with dementia as well as support their carers. And so the Bahamas Alzheimer's Association is heavily active in asking our Ministry of Health about what's our plan and developing that Alzheimer's plan, as well as pushing for an older person's protection bill that can help reduce abuse and neglect of older persons, but also put in place strengthen plans for long-term care and how we're refunding this. So should families need this support later on down as older persons' illnesses progress, including dementia. So these are some of the advancements that I'm most excited about because it'll help to strengthen communities and society in general. Alzheimer's is a very costly disease. It costs societies billions of dollars every year. We have an aging population worldwide, including in the Bahamas. So the older persons that we have now is expected to triple by 2050. And we have identified that families are smaller. I mean, a couple generations ago, families had 10, more than a dozen children. I know of people in Andros who had 22 children, but their children had less children, and their grandchildren are some of them are not having any children at all. So the point is that who's going to care for them when they get old? So our aging population is increasing while our caregiving population is decreasing. Yeah. And that difference is going to be seen and be very apparent in just a few short decades. Yeah. And what are we putting in place for people to get care and support as they age beyond retirement and so on?
Yeah, because you also have a lot of families that are having children later as well. So if you think about it, in my parents and grandparents, especially the grandparents generation, they started having kids 18, 19 because they were married at 14, 15, right? And so that's a part of the reason why they can have 10, 12 children because if you get married at 16, 17, and you start having kids 17, 18, you have a very long shelf life, so to speak, of being able to have kids.
Right.
But if you think about it, like I'm turning 40 this year and I have a 6-year-old and 1-year-old, right? Then I run the calculations all the time. I'm like, right, when I'm this age, these kids are going to be this age. And it's just like, what have I done? You know what I mean? But, and I think there's that part of it as well. So not only do you have less kids being born, you also have a lot of those kids are being born to older parents because of pursuit of career, because of I want to get, I need to have a house first, I need to do this first, I need to have da 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 da. And so all of these things add into, okay, this is fundamentally shifting what our society looks like. And when you circle it back to this conversation, you're going to have people who are grossly unprepared for taking care of parents because they'll just be getting out of college when some of the parents are hitting 65, 66, when you're starting to potentially see some of the earliest signs of a disease like Alzheimer's. So there's a lot that comes into play in this conversation. I'm hoping that, you mentioned education earlier. I'm hoping that our conversation would help to increase the level of education amongst people in terms of being able to listen through and get some ideas about, taking it seriously, looking out for the signs, trying to get intervention started early. And I'm hoping that, this helps to kind of soften some of the stigma. We have a lot of issues with stigma, especially when it comes to things, anything to do with mental disorders, anything that deals with the brain. We tend to have a lot of stigma issues with it. So I'm hoping that this conversation can help to dispel some of that and drive people to be more proactive in dealing with either themselves or their family members, their loved ones, who they may see some of the signs in. So I want to thank you very much for taking time out of your busy schedule to talk with us today. I think it's a very excellent conversation.
Thank you.
Obviously very knowledgeable about the topic, a lot of experience, and it shows in the nature of the conversation. So thank you very much. And I'm hoping we can get you back on another time to maybe have some other conversations in this space as well. But thank you for your time. And for our listeners, As always, we thank you for listening, and we invite you to like, comment, subscribe, and most importantly, share. And remember that September 21st is World Alzheimer's Day. So be sure that if you take a listen, share it to somebody so they can get this information and this knowledge as well.
Thank you.
Thank you.
When accuracy, efficiency, and simplicity matter, choose Doctors Hospital Laboratory Services. We are the premier outpatient laboratory service in the Bahamas, delivering timely results you can trust. Experience the ease of testing with us. Accurate, fast, and hassle-free. Doctors Hospital Laboratory Services, where precision meets convenience. Give us a call at 302-4759 to get started today.